Broadcasting from the business capital of the world, this is the Podcast Business News Network.
And welcome back, everybody. Today, we're going to talk about something that really affects all of us. It's our healthcare, our health insurance. So many misconceptions about it. Tough to understand for many of us. Even if you're getting your insurance through an employer, obviously you are paying for part of that. It's also a big expenditure of your yearly salary many times. And then we add in the copays and the deductibles and all of it. It's all confusing. And she's here to help you understand it with many, many years in the healthcare industry. And now she helps you navigate your healthcare. She's basically your advocate. Maura Carley is on the program with us. Maura, welcome back. How are you?
I'm good. Thanks for having me again.
Thanks for making sense out of this thing we call health insurance and healthcare. Where do we start? I know there's a lot of misconceptions about healthcare and health insurance. Why don't we start with COBRA? Because many times, if you're on COBRA or you're facing COBRA, you're in a stressful, challenging situation already. And now you're looking at paying more for your insurance that maybe you weren't planning on doing, previously. Can we start there?
Yes. There are many important matters to discuss about COBRA. First, let's go back to the origins of it, why it passed in the first place. It passed in the mid-'80s, and it's the temporary extension of the group coverage that you have. And the reason it passed is because, until 2014, in most states, if you left your job, you were facing an individual insurance marketplace that took your health status into account. So COBRA was intended to be a very important safety net for you and your family to be able to lose your job and not lose your coverage at the same time. Unfortunately, everything's gotten so much more expensive that the term COBRA sticker shock,
Oh my gosh.
exists for a reason.
As soon as you hear the word, we're going on COBRA. Oh boy. Yeah. Essentially, you're paying out of pocket for your insurance for the most part, sometimes all of it.
You're paying 100% unless your employer has agreed to subsidize it for a period of time, and there's an administrative fee. So the federal COBRA legislation applies to all employers of 20 or more employees, whether they're on the plan or not. So that's another issue to keep in mind. If you're working for a smaller employer, then mini COBRA applies, and you need to find out what that means for your state, because unlike the federal COBRA, which is up to 18 months of coverage for the worker and his family, his or her family, and in certain circumstances, up to 36 months for dependents. In divorce, for example, someone losing their coverage through divorce can have up to 36 months. But those numbers are usually smaller in if you're working for a small employer, but there's always an exception. New York is the exception. Another misconception is that the worker has to take COBRA for everybody to be offered COBRA. That is not true. And that's a terrible problem with people who turn 65 and elect COBRA, because, the structure of Medicare is pretty much you get on it at 65 unless you have active group coverage of 20 or more employees through your work or a spouse's work. And so if you take COBRA, you can miss important enrollment windows. And people think of Medicare, I worked all my life and now I get Medicare. But you know what? If you don't follow the rules, they're very punitive. And so that's another issue with COBRA. People retiring, being offered COBRA, and they should be getting on Medicare, but they don't because they think they need to take COBRA to get their family covered. Each member of the family has a COBRA right. What else? You don't get offered COBRA until you've lost your group. That's just how the system works. Alarms a lot of people. Oh, my coverage is ending at the end of the month and I don't have my COBRA notice. Well, that's pretty typical. The employer processing a termination is what triggers communication with the COBRA administrator, who then sends out a letter. And again, you have a window to act and your COBRA will be retroactive.
Hmm.
The
Can
other
we,
one
you
more thing.
mentioned, sure, go
Yeah.
right ahead.
Well, if you elect COBRA, as opposed to going to the individual market for your insurance, and you've got to evaluate those things, because COBRA often is better coverage because it's group than what might be available in the individual marketplace. But you might qualify for a subsidy if you go to the individual marketplace, or you might pay less. It depends. So you have to do your homework. But if you elect COBRA and don't have some kind of qualifying event, you have to stay on it until the next annual open enrollment, or until COBRA ends. So there's just that one little slice of our healthcare field is so complex. And if your company goes out of business, there's no COBRA. That's also a misunderstanding. You're an appendage to the group. If there's no group, there's no COBRA.
Wow. So what you're saying, Maura, is if you're facing COBRA, take a look at the marketplace, because it may be a better deal in the marketplace based on your salary. You might get some credits from the state, as opposed to taking that crazy COBRA number, right? And then you mentioned mini COBRA. I've never heard of that before. What is that?
Well, it's essentially what the state offers for small employers, small, fully insured.
Okay.
If your employer is large and operates in several states, it's likely, it's more likely you still have to find out that it is a self-insured plan. And that means you'll always be under the federal guidelines if your employer is 20 or more.
Okay.
So, again, there's so much that people need to know.
I do recall at the tail end of COVID, they extended COBRA, which was beneficial for a lot of people. I think it gave you like an extra 6 months or so. They tagged it on there. A couple of people that did that, and I guess a saving grace for a lot. Let's pivot over to deductibles. So confusing. Every policy is different. What can you tell us about that?
Deductibles, again, people think it's simple. It's what I pay before my insurance kicks in at the beginning of the benefit period. For many people, that's January 1, but it could be any month. Sometimes deductibles are cumulative. So whatever claims you have get charged against that deductible. Sometimes there's different buckets. Medical is one bucket, drug is another bucket. So these are things you want to know. You also want to know, how large is it? Before healthcare was so expensive, and you can see from my white hair that I've been around a while. Things were very,
and that's a good thing, by the way.
well, I can remember when things weren't so expensive. I'll give you a couple examples. My husband and I used to have our families insured by both of our employers because we didn't pay anything. Can you imagine?
Whoa. Oh, all right. Well, I got to understand that. Both of your employers, because many times, if I get this right, now you can't have secondary insurance. It's one policy. That's it.
Oh, no, you can, but people rarely do it because it's so much comes out of your salary to pay for that coverage. What I'm saying is I'm old enough that either what we had to pay was so negligible that we could have our children, all of us double covered. And do you remember the term the birthday rule?
No.
That was a term to determine if you had two sources of coverage as children, which parent's plan paid first. It was the one who had the first birthday. Now no one's even heard of that because it's so rare. People have to pay so much. So that's just
Wow.
underscores how expensive things have gotten. Um, and again, deductibles have gotten so high. And it depends on how you're covered. If you're covered by a government entity, you are blessed. You are so blessed. The coverage is usually very rich and you pay very little for it. But in the individual market, you can have deductibles thousands of dollars.
And
Thousands of dollars.
like you said, different buckets, and that's a great way more to put it, because you have the family deductible, you have the individual deductible, and figuring out the buckets that they go into and what's left in the year, um time period in terms of those buckets, those deductibles. Is that when the policy was enacted? Is it January 1st to the end of the year? How was that all working?
Well, for the individual market, it's January 1st. Open enrollment starts November 1 for a January 1st effective date. But although so many groups have a group, we're talking about employer-based coverage now, have a January 1 date.
Hmm.
You can have different dates, and you do. But you know what? Before I lose my train of thought, I just want to say when you're selecting a plan and you are offered plans with varying deductibles, be careful. Be careful because, the higher the deductible, the lower the premium or the lower the contribution, right? And the reverse is true as well. But, you need to be able to cover that deductible if something happens. For example, we had a client who was going on to Medicare in a few months and taking insurance through the individual market, not subsidized. She was paying for it. She was in good health, but she chose a very high deductible plan and had a terrible skiing accident in those, few months she was home. In retrospect, she would have been so much better off taking a plan with a lower deductible for the 3 months we were talking about. So I just give that as an example. People have healthcare issues on their to-do list, but my impression is they're often just not thoughtful enough, thinking through the scenarios, the what ifs.
How do you make that determination whether you should take that plan that has the uh, higher deductible?
Well, let's face it, people who are on a tight budget have to make more difficult choices.
Yeah.
And it's all a matter of risk tolerance. But you don't want to have buyer's remorse. Oh, I wish I had just paid the $100 more a month, and then I wouldn't have thousands of dollars in medical bills. And it happens a lot to young people. They they,
Mm.
they haven't had serious illness and they're confident their good health will remain. And that's not always the case.
Yeah. And I guess also it's a challenge too. If, let's say, you're in a divorce situation, you're the money spouse, you have to provide insurance for the family under your agreement. And you look at it and you say, you know what? I'm going to go for the higher deductible. Gosh forbid something happens to your ex, out of your control, and now you're on the hook for it as well. So yeah, there's a lot to it's a delicate balance.
Now,
Yeah.
some of these high deductible plans come with health savings accounts, which are just like checking accounts for medical expenses. If
Hmm.
your employer is funding one of those or helping, you can also contribute. And there's a limit to what anyone can contribute as an individual or a family. That is a compelling reason to take that higher deductible plan
Okay.
because if the employer is funding your health savings account, that's your money once it's in there. It's not like a flexible spending account. That's
Okay.
a use it or lose it kind of thing. But the health savings account, once money is in there, that's your money, which is
Hmm.
pretty sweet. And you can use it for current medical expenses, or you can use it for future medical expenses.
I have to tell you, I haven't heard of that in a long time. Where they're putting money in your account. Flex spending different. Let's look for a quick moment at flex spending. A lot of people may not know they even have it. How does it work? Basics on how it works.
Well, when you're choosing your plan, and with group plans, there's an annual election, and it's almost always done online now. And that should be part of it. If your employer is offering a flexible spending account, you elect to have a certain amount withheld from your salary. And then you can submit claims to either be reimbursed if you've paid the provider, or you can always, well, I should never say always, I guess, in this field, there's always some exception. But for example, my husband has one, and you have the option of paying the provider directly. But the key difference between a flexible spending account and a health savings account is if you don't use what's in the flexible spending account during the course of that year, and you may have, a period beyond the year where you can still submit claims, of course, but you're supposed to use that money. And if you don't, it reverts back to the employer. And that's why you have a lot of people at the end of their benefit year who put too much money in, going online and buying, you know, um, uh, all kinds of things that are FSA eligible
Mhm.
uh, to use that money.
So the FSA, to understand this properly, it's money that you elected to come out of your paycheck to go into an account, no tax on it. So that's the advantage right there.
Right. I was going to get to that. It's tax
Okay.
advantage, yes, because you're paying those expenses with pre-tax dollars rather than after tax.
But if you don't take advantage of that money that you pivoted over to the FSA, you just threw it away.
That's right. That's right. And
Hmm.
so that's so different from an HSA, health savings account, because the whole purpose of that was to give people a vehicle to build a little nest egg. Now, some choose not to build a nest egg, and they use that, to meet their deductible, and they don't build much of a balance. But oh my gosh, some people have really built up that nest egg. Of course, you have to start uh, younger to have more years to
Sure.
put in there.
Hmm. Good stuff today. I mean, we're drilling down here. Why don't we look at Medicaid?
Medicaid. Well,
Yeah.
Medicaid, you know what? Medicaid and Medicare are often confused by people. Medicaid is the program for the lowest income Americans. And what the Affordable Care Act did was improve the plight of those on Medicaid in most states, making um, people eligible and able to make. But you know what? Let me say this a better way. You have to. Not all states have embraced the Affordable Care Act system for Medicaid, and most of them are in the Southeast. And so the terrible problem we face is that some people
Hmm.
in those states make too much money to qualify for their state's Medicaid program, um, but they don't make enough to qualify for subsidized coverage through the Affordable Care Act. So, you know what? Medicaid is so complicated, but it's
Mm,
always state based.
gotcha.
Very different from Medicare, which is our program for older Americans. And that's complicated too. Many moving parts. Medicare Part A, Medicare Part B,
Oh,
Advantage plans are Part C, Medicare Part D. All of it is complicated. Honestly, it's too complicated. It's ridiculous. But that's why people have to spend some time on it, knowing their situation. And some people in those states that haven't um, embraced the Affordable Care Act changes with their Medicaid programs have residents who just aren't ever going to qualify for their Medicaid program. But slowly, I think there's only 10, maybe 12 states that aren't under the Affordable Care Act's Medicaid expansion. I think Oklahoma just did that. So that's easy information to Google for
mhm.
someone who's wondering, what situation am I in?
When we say Medicare, what age are we talking here? Is that 65 and above?
It's 65 and above for most Americans, but if you are diagnosed with end-stage renal disease or you're deemed permanently disabled by the government, by Social Security, or you have Lou Gehrig's disease, there are ways you can qualify for Medicare earlier.
Okay.
But you have to have paid into the system through your payroll taxes.
Is is it true that if you are 65 and above, you don't have a lot of choices? You usually got to take Medicare?
That is true. And the exception is the people who have active group coverage through an employer of 20 or more, and that's active group through their own work or a spouse's work. And the rules for small employers are based on the state you live in. And I think we shouldn't even get into that.
Yeah, yeah.
Most state insurance department websites are pretty helpful, but and frankly, calling your state insurance department, you can call and ask for a medical examiner and often get someone very, very knowledgeable. So
I don't want to be negative here, but anytime I talk to the state and the marketplace, or just my experience so far, hasn't been the best one in terms of disseminating information. And I'm basic, just give me what I need to know. And a lot of times they don't have the answers. They're confused. One rep is confused with the other rep. They give out different information. That's just been my experience. Just throwing it out there.
no, I hear you. I just think it's such a bad system. I have sympathy for those people. Coverage can change year to year.
Sure.
And we tend to not know anything about the following year until very close to November 1st or November 1st. And most people are shopping during that window because for January 1, the window is November 1 to December 15th.
Yeah.
And it's just too short. It's just too short. Now, some of the states who run their own exchange or marketplace, those are synonymous terms, have longer enrollment periods. But the federal is usually November 1 to December 15th. And these people are crushed.
And you have other responsibilities, and it's almost a job trying to figure out your insurance in that time period. Just for my own curiosity, top of your head, Maura, how many states have their own marketplace where they require you to go through and pick your insurance there?
Oh gosh, I don't know exactly. We used to keep that information on our website and it was
Complete.
changing. So it's probably a dozen. It's probably 12. But
Okay.
it's easy to Google.
Yeah, I thought it was higher than that. So interesting. I know that Florida, New York, those are two.
Oh, not Florida. No, no,
No,
no.
somebody told me it was. Okay. Hmm.
You have to go to healthcare.gov. You know what? That's one thing that works so well. Go to healthcare.gov.
Hmm.
You're asked for your state of residence and you'll get redirected, or at least you'll find out. Because only if you have your own state-based exchange, you have to use that. And
Right.
there are a number of northeastern states, Colorado, California, and then there's some joint platforms, there's different nothing simple. It's not yes or no, but I think it's about 12 states, and
In
everybody else needs to use healthcare.gov.
thank you for that. I wasn't even aware. In your opinion, and just got seconds left, but I'm kind of curious based on your experience in the insurance industry. Do you think it would be better for those 12 states to allow you to pick your insurance privately or go through the marketplace? So the marketplace is there if you need it, and you get the, government credits and all of that. If you qualify, if you don't, then you're paying full freight, and you have no choice. You have a couple of, maybe two, got to pick one of them, as opposed to there being competition out there to keep the cost down.
Well, most people have to buy their coverage through the marketplace because it's 75% subsidized. And if you don't get that subsidy unless you go through the marketplace.
100% agree. But in the example I gave last time we got together, state of New York, if you make more than $111,000, family of four, you get no credit. You're paying full on.
Right. And I think we discussed last week that at least what's in effect for now is that which has more people returning to the marketplace who were buying privately, is that you don't have to pay more than 8.5% of your income toward premiums. So that's in effect this year.
Is that automatic? Does that automatically take place, or do you have to advocate for that? No more than eight. What is it? 8% of your gross salary?
You know what? Let's talk about that next week, and I'll get more details.
I would appreciate that, because that's a biggie right there. And if you don't ask for it, you're not going to get it, I'm assuming. And they're just going to.
Well, I don't know. You should, but you're not going to get it if you buy directly from the insurance company.
You cut out just a little bit, and that was very important.
You're not going to have that protection if you buy your individual insurance directly from the insurance company.
Oh, absolutely. It would have to go. And you know what? You can't in those states, as far as I know, with the marketplace, you got to go through the marketplace. I've asked other, vendors, New York. Oh, I'm sorry. You got to go through the marketplace. Thank you. And have a great day.
Yeah, but that's not correct. We discussed that last time. So I've got some homework for next week.
Yeah.
How many states have their own exchanges? I'll come back to you with that information.
And the 8%. What's your website, by the way? If somebody is challenged by their insurance, especially if you're over 65, you're faced with Medicare, you have a nice nest egg, and you can work with somebody that can lead you along with your experience. How do we find you?
The website is healthcarenavigation.com. I just want to be clear that we're fee-based consultants.
Sure.
We're not brokers. So the only way we have income to pay my staff is clients who pay us.
Yep.
And sometimes that's not well understood.
Well, we make it clear here, because if you think about what you have at stake to lose, to have somebody in your corner and many different programs you offer, I think it pays for itself. Based on my experience dealing with insurance companies, if I could tell you how much I paid in the last couple of years, well, I don't even want to go there. It's like, if I want to know, it's a crazy system. Maura, great having you on with us. Thank you. I totally appreciate all the info, and look forward to getting together again next week.
Are you looking for even more of the podcasts and hosts that you love? The Podcast Business News Network is proud to announce that you now have even more ways to listen live. Check out the MyTuner Radio, online radio box, and Simple Radio apps on iOS and Android, or find us online. Search for Business News Network on mytuner-radio.com, or search Podcast Business News Network on streama.com and onlineradiobox.com/US. Take your podcast on the go and don't miss a minute of the action.
Broadcasting from the business capital of the world, this is the Podcast Business News Network.
For nearly 2,000 severely injured veterans, everyday life has become filled with barriers.
Day-to-day simple tasks can become pretty daunting.
I have to carry my chair up 2 flights of steps or have somebody do it for me.
What scares me the most is just the falling.
When I'm struggling with my house, I think, to have that one great barrier just knocked down, it's crucial.
Home for Our Troops is a wonderful nonprofit that builds a
mortgage-free, fully adaptive, handicap-accessible house.
And there's no catch.
It'll be our very first home that we've ever owned.
This is a game changer.
This is where your life begins again.
We need you to join us in completing this important mission. Please visit hfotusa.org and help build homes and rebuild lives.
Because of you, everything's going to be okay.